Okay guys, hi, good morning, good afternoon. Anytime you come across my video, good afternoon. My name is Esther, a mom of two and a wife at the same time. Presently I'm a full housewife. I'm not working, I'm raising my children, but looking out for opportunity actually. So I'm going to be talking about my experience with high blood pressure after I had my baby. And the reason why I'm doing this video is there's a lot of mothers that are actually looking um, for, they are asking questions actually. So this happened like when I had my first daughter. She's almost 2 years plus now, and she's 2 years plus, and I have a son presently. So currently, right? So when I had my daughter, few days after my c-section, because I had a c-section for my first child, after few days after my c-section, 3 days to be precisely, I had high blood pressure. So my blood pressure went over the roof, and I was looking for solutions. I was asking questions actually, because there are some questions in your head that even when you ask your doctors, they explain to you, is it normal? At that time when I come online to search high blood pressure after childbirth, all the videos I was seeing online on YouTube, on TikTok and all that was they were talking about high blood pressure in pregnancy. I was like, throughout my pregnancy I didn't have any high blood pressure. My blood pressure was normal, everything was normal. Even after I gave birth, 2 day, first day, second day, till the third day in the morning, I woke up and they checked my blood pressure. They're like, it's high. So I was asking questions, what can I do, and all that. So I was not seeing what I was looking for. I was not getting the information I wanted from online. So I decided, like, okay. So I was searching. It was like few months later that I saw a particular video on one app when a lady was talking about high blood pressure after childbirth. So I was like, oh, okay. So that was what able prompts me on doing this video. Like, okay, yes, I want to talk about this, how I was able to manage my high blood pressure, how I was able to bring it down to reasonable, and how I was able to manage it all through. Right now I'm not on high blood pressure medication, so I just want to share my experience. I know that there are a lot of people that are going through this same phase, and you'll learn on one or two things. And so let's just right into the video. So how was I able to manage my high blood pressure? Sorry, how was I able to manage my high blood pressure, and what did I do differently? So first thing first, after they detected in the hospital that my blood pressure is going up gradually, they asked me some questions. They run some tests. They did urine test to see if there's protein in my urine. They asked me if I had blood pressure during my, I'm like, no, I didn't have any blood pressure. They're like, oh, is it because of the surgery? They should try to find out what is the cause for that blood pressure going up. So they didn't find anything. They're like, okay, it's normal. What are you going to do? We're going to put you on medication. Now, like, for how long? They're like, okay, if your blood pressure don't go down after 6 weeks, you have to be on the medication for life. I was like, no. I can't be on this medication for life and all that. So I took the medication. I got discharged. Because of that, they extended my stay in the hospital. So I was supposed to be discharged like 4 days later, but I was held in the hospital for almost a week. A day to my baby naming ceremony day was the day I was discharged. That was when I came home. We did the naming ceremony. Like few days later, I was weak. They asked me to come back a week later for checkup, and getting to the hospital, they checked. My blood pressure was as high as 170 over, despite the fact that I was on the medication. So like, okay, they're going to increase the dosage for my medication, and they increased it. So after increasing my medication, I was at home. I was taking the medication. So after increasing my dosage for my medication, so I was at home. I was taking the medication. But I was still checking every day, checking morning and night to see if the blood pressure was going down. So at some point it was coming down to like 140, 130, which is not still normal blood pressure. 140 today, tomorrow 130, next morning is going to 150. So but in the hospital they was telling me that I should rest. So the first thing for us as a mom, they will tell you that when you have your child, try to rest. See, it's very important. But especially first time mom, I don't want anybody to carry my baby. I'll do a different video actually talking about my pregnancy journey, how was my postpartum, a little depression here and there. So I was not resting. But when I noticed that this blood pressure thing, I was having, my heart was panting and all that. First thing, what I did was, first, I was taking my medication. Take your medication. If you don't have any other alternative to bring your blood pressure down, take your medication. So I was taking my medication. Then I introduced rest. So at some point I started giving my baby to my mom. I'll sleep. I'll try to rest. Sleep. I'll sleep in no reasonable amount of I sleep very well. I drink a lot of water because I was taking a lot of water. So because I have a C-section, I couldn't do exercise here and there, and I had flu in my body. So the thing is, my leg was swollen. There was a lot of water in my body, and a lot of people is telling me that, oh, this water is normal water that is in your body. Say when you have your baby, a week later the water is not out, please find solution, because this water is not good. So the water was part of what was even lifting my high blood pressure. So I started taking actually took apps, a lot of agbo. I took agbo. So the agbo helped me to flush out the water. All these I don't know how to pronounce. There's this Igbo thing that you can cook and drink to just flush out bad blood, take blood after giving birth. So all those things, sorry. So all those things was what I was doing, what I was taking during during the time that my blood pressure was high. So after I did that for 6 whole months. So when because I was doing exclusive breastfeeding, so there are some things you cannot take when you are breastfeeding your baby, because it might push them. So this hibiscus leaf, I tried. They told me that it's good, but when I took it, my baby started purging, so I put a hold on it. So when my baby was 6 months, so what I did, when my baby started clock 6 months, in the morning I would breastfeed him very well. I breastfeed her very well. After breastfeeding her, I'll boil the hibiscus tea. I'll take it. Then when my baby is hungry and she wants to eat, I'll put my baby on formula, because she's already 6 months, she's already eating. I'll put her on formula. So after taking the hibiscus tea, I make sure I don't breastfeed my baby for 2 hours straight, 2 to 3 hours straight. Then after that, again I'll breastfeed my baby. So I was taking the hibiscus tea morning and night. After the hibiscus tea, you rest. See, that rest was still important, but I was able to manage that I continue like that for a whole 1 year. And after 1 year, and I know aside, because if your blood pressure is high, please always check, especially when you have a baby, because there is a lot of things that can happen, can go wrong. So I was always checking. So one time I just went to check, and I noticed that my blood pressure was at 108. After that was when I started I was taking my blood pressure medication, and I was taking the hibiscus tea. I was still on my medication. Take your medication, it's very important. So I was taking my medication, and I was taking the hibiscus tea. I noticed it was 108. So I went back to the hospital, like, okay, this is what I'm doing. I explained to my daughter, this is what I am doing, this is the result I am seeing. And the doctor advised, okay, at this point we need to reduce your drugs, because let me tell you how bad it was. The blood pressure medication that I was taking there was one medopin, something medopin. I was taking 2 in the morning, 2 in the afternoon, 2 at night. There's another one, the red fellows, I don't know their name. There's another one that is red. I was taking that 1 in the morning, 1 at night. So I was taking like 6 medication for my blood pressure. So that's to tell you how bad my blood pressure was. So like, we need to reduce the medication. I think it's going down. so they reduce the medication. But the doctor said something, say we are reducing the medication, meaning that you have to keep checking again to know if it goes up, then we increase the medication. So I started taking my medication. They reduced it. I was taking the tea. I noticed that it was still 108. A week later, because then they're like, I have to be coming every week now. A week later, I went back to the hospital that it's still 108. So the doctor reduced all the medication. I was taking just one medication per day. He now told me that I should keep checking. If it goes up, come back. But if it go as low as 100, I think we need to stop the medication. So I went home and I continued checking. And there was one particular day I checked, my blood pressure was 100. I went back to the hospital and they're like, oh, at this point I think your blood pressure has normalized, because for you to take just one drugs and it's still going as low as 100, at this point you need to stop the drugs. So that was how I stopped my blood pressure medication. Well, after stopping, my doctor advised me that I should keep checking, because once you've had high blood pressure, you have to just keep checking time to time. Yeah, it might not be every day anymore because the blood pressure has normalized, but you just have to keep checking. So I once in a while I keep checking. For a whole 6 months I was checking. My blood pressure was normal. I took in for my second baby, I was still checking, and my blood pressure was normal. So that was how I was able to manage. So blood pressure after childbirth is real. It can happen. It's not just in pregnancy that you can. Some people have high blood pressure when they are pregnant, but if you don't have it when you are pregnant, when you have your child, please check. Because if not that I was checked, I was still in the hospital. Maybe I was discharged, the blood pressure did not come up and I was discharged and I went home. To be sincere, I don't think I will even check to know that to check my blood pressure. I just feel like, okay, I'm fine, I'll be cleared by the hospital to go home. So it was because they were checking my blood pressure. That was how I was able to find out that the blood pressure went up, and with proper management I was able to be off the medication. And when I have my second baby, it happens again. After I had my second baby, December 2025, which is this last year. I had my second baby, and 4 days after, because I had a repeated C-section, I'll do my best story actually, so to talk about. And 4 days after, my blood pressure went up again. And now my baby is 6 months. My baby clocked 6 months June 20th 2026. That was last month. And I'm off my blood medication, because because of my first experience I already know how to manage this second one. And with prayer and all that, right now I'm not on blood pressure medication and I'm fine. My blood pressure is normal and I'm okay. So if you are a mom, you have this experience, just share in the comment section. Tell me how you were able to manage your blood pressure and what you are doing, and if presently you have blood pressure and after your childbirth and you're taking care of your child, just say your experience and how you are going, and let's see how we can help ourselves. I'll be dropping a lot of video on this channel. Please kindly follow me for more. Let's create a community. Let's say our experience as a mother. Motherhood is sweet. It comes with a lot of up and down, and I know that we got on our side. We'll go through it. Thank you guys. I remain your girl, Esther.